Hi, I'm Anya Suico, and with me is Dr. Angela Aguilar. She's the Associate Professor for the Reproductive Endocrinology and Infertility section of the Department of Obstetrics and Gynecology at the University of the Philippines, Philippine General Hospital. She's also an active consultant at the CARMI Fertility Center in St. Luke's Medical Center, Global City, and the Public Relations Officer for the Philippine Society for Reproductive Endocrinology and Infertility, which is now the Philippine Society for Reproductive Medicine. Yes?
Hello, Anne.
Hello, Dr. Aguilar. Very, very glad to have you today. Our first question for you is actually it might seem simple, but lots of people are probably wondering, what's the difference between an OBGYN or an OB-gynecologist and a fertility specialist?
Well, an obstetrician gynecologist is a woman or a doctor trained to consider all possibilities in terms of reproductive health. Okay, she can screen and treat simple cases, and she can provide contraception as well as assistance for fertility. But we take additional training after our residency in obstetrics gynecology, and that training may last from 2 to 3 years, and we're able to provide not just general fertility care, but specialty fertility care, and we are able to diagnose not just the top 4 causes of infertility, but the more rare ones. In addition, we are able also to provide interventions that are more specific for fertility, whereas a generalist can discover if you have ovulation problems or if you can time your baby making towards the time that you're ovulating. But a fertility specialist can diagnose fertility disorders that are due to ovulation, can provide treatment for very resistant cases, and can provide additional modalities for women who have other problems such as tubal disease, male factor, pelvic factors such as endometriosis, severe ovulatory disorders, usually from polycystic ovary syndrome, or from hypothalamic or pituitary crisis, or some other endocrine causes. We also treat women who have recurrent pregnancy loss, those women who keep on miscarrying and cannot get a life from all their pregnancies. So there's specialty care for that, and if a woman goes through specialty care, we expect that the process will be more efficient. The woman can reach pregnancy or her pregnancy goals at a faster time, at a more cost-effective way, and will minimize interventions that may be unnecessary, invasive, or even expensive that may not really reach the conclusion that they need.
So it's really about the focus and the training to be able to tell whether or not it's really an infertility case.
Yes.
I see. Okay. Thank you so much for explaining that to us. The audience sent in their questions, and this is the case that we'd like to ask you about. So the first question po, is there a certain type of food na makaka-fertile or that makes a woman fertile?
There's no specific food. We encourage a very balanced and healthy diet. Of course, minimize processed foods as natural as possible. Eat plenty of fiber, limit your carbs and fats, and make sure drink plenty of liquids and water. And that will be the best way, a balanced diet towards fertility. We also want you to avoid harmful lifestyle factors such as smoking or heavy alcohol.
I see. So, balanced diet and healthy lifestyle is, of course, the number one thing to establish first. Okay, great. A follow-up question is really more details about their case. Kasi yung egg raw sa ovary ko hindi lumalabas, sabi ng OB ko. 8 years na kaming married. Ang dami na po naming na-try ng mga gamot at herbal, wala pa din. May pag-asa pa ba kaya kami magkaroon ng anak sa edad kong 32 years old? Please give me some advice how to get pregnant. God bless.
Well, that looks like a very promising case. First of all, her age,
Apo.
32. Still very young for the usual demographic that we deal with. And what she reveals as hindi lumalabas ang egg niya sa ovary, that sounds like an ovulatory disorder, or the woman is not ovulating because her eggs fail to mature on time. So that has very good treatment options. Once we're able to diagnose a hormonal imbalance, likely it's a polycystic ovary syndrome, we will be able to give either supplementation or hormonal treatment to cause her to ovulate. And the ovulation shall be documented, and baby making can be timed appropriately during the time that the patient is ovulating.
I see. So, it's actually good na nagsisimula na po siyang magtanong. Now's a good time.
Correct. And her age is still okay,
Apo.
age 32.
So, marami pong na-discuss about the age factor. I mean, are there other factors that you think should be considered in the fertility process, just so that people can understand it a bit more?
Don't forget that it takes two to get a pregnancy. Always remember to consult as a couple, because, well, in the Philippines, the husbands may not be upfront in terms of having themselves evaluated. So, ovulation disorders may comprise just 30 to 40%, but half of the problem, of course, may reside with the male factor. So, an evaluation of the male, just a simple semen analysis will be required. If we can push through with that, then definitely it will give us a lot of information and help us with regards to which focus in terms of fertility management we can proceed with.
Okay, so always po as a couple, that's very helpful, Doc. Sana natulungan natin yung mga couples na maraming tanong tungkol sa fertility. Thank you for joining Baby Goals, Doc.
Yes.
And thank you for watching. Stay tuned for more information to help you meet your baby goals.
Thank you.